All right, thanks everyone for joining us today. I have with us Laquanda Steward, our Director of International Operations, and Cathy Vollmer, our Vice President for Greenstaff Medical U.S. and a registered nurse as well. We're going to cover the topic of international visas and how organizations can best be using the different options there. You know, obviously there's a lot of change in the marketplace, and our team has worked really closely with a lot of international nurses to bring them in to the United States and help healthcare facilities. So with that, we're going to jump into some questions and answers with Cathy and Laquanda. And so Cathy, we'll start with you. Question number one, how should international travel nurses fit into a hospital's broader staffing strategy?
International healthcare staffing has been around for a while, but it has grown in its utilization due to the continued shortage of healthcare personnel. This does allow an institution to have access to healthcare professionals that they would not otherwise have ability to recruit or to help sponsor or to have available to them for patient care. What I normally see is that the traditional travel and per diem staffing meets the general staffing more immediate need of a healthcare facility. However, international candidates meet more of a recruitment strategy that aligns with the recruitment strategy that the hospital is creating for longer term types of personnel that they are recruiting.
Excellent. That makes a lot of sense. And how can international nurses address staffing shortages or patient care demands?
And as we see, healthcare shortages is continuing. We have not overcome the aging population, the access that we are fortunate to have for healthcare within the United States, and the opportunities that healthcare workers have to work in a variety of different venues. So there will continue to be a healthcare shortage. So international personnel does help cover part of that gap in ensuring that there will be adequate quality patient care that the healthcare facilities can deliver as they expect to and that they say. I did want to share that international healthcare personnel are placed in acute care hospitals, long-term acute care settings, and long-term care and clinic type settings. The exact areas Laquanda is going to go over in just a little bit. And what this affords the facilities and how this does help is it provides consistency. They have these healthcare personnel for longer periods of time, not the 13 weeks, but longer periods of time. And they do become permanent members at a point for that healthcare facility.
Excellent. That's great. Laquanda, why don't we kick it over to you, and if you can give us kind of a brief overview of different visa options for bringing over these international nurses.
Absolutely. So as Cathy stated, with all of the facilities that we work with, we are able to provide our clients with alternative visa options based off of timelines and when the facility may need the candidates the most. So we have F1s who are our international educated disciplines, medical laboratory specialists, registered nurses, as well as physical therapists. We also have those F1 candidates. They're already here in the U.S. They've come over to the U.S. to get additional education. And so those candidates can start really quickly. And then we have our TN option, which is our Mexico and Canadian candidates. Those are also international candidates. Either they're born in those particular areas or they've traveled through Canada or Mexico as an alternative route to the U.S. And so those individual candidates can also arrive really quickly as well, which we consider our quick starts. This will be provide our facilities the opportunity to place them within a couple of months of them arriving here in the particular state. We also offer H-1B lottery, which is a lottery that takes place every year, once a year in April. And we have candidates who will be able to arrive anywhere after October 1st, as well as H-1B cap. Those candidates are specialized disciplines. They are able to arrive in the U.S. within about 6 to 9 months, depending on how quickly we're able to get their visa. But these are specialized. These will help our facilities who are needing ER, ICU, PACU, as well as medical laboratory specialists and PTs in a fairly quick manner.
Excellent. And so how does our team at Greenstaff that you and Cathy lead help alleviate these issues with visas, immigration, and credentialing to provide a streamlined process for nurses traveling internationally?
Well, the first is education, both to the clients and their team, and listening, understanding what their needs are, what they're trying to accomplish as far as a long-term goal. And then from that point, we come up with a process that will meet their needs in the easiest and fastest way possible. The goal, again, is long-term partnership so that we are able to provide them with the alternative visa options where candidates are staying on board with them anywhere between 2 to 3 years. And after that commitment of the contract completing, then transferring over to the actual client as a full-time employee.
I wanted to add on, we also support that initiative prior to them starting and throughout their assignment, as Laquanda stated. But we do have an in-house immigration attorney. We have clinical support, and we have program managers, which Laquanda is going to go over in a little bit.
Yeah, and so just to add on to the clinical support is we provide that prior to arrival to get them fully ready and acclimated to their new assignment, and even throughout their 3-year commitment contract. And so this will allow our clinical managers to partner with the facility's clinical team to make sure that we're providing the necessary resources and support to the clinicians as they acclimate to the U.S. settings.
Excellent. Makes sense. And so, Cathy, turning it back over to you, as organizations look at this from a financial perspective, how do they balance international nurses compared with domestic travel nurses and kind of the cost and different options they have from that standpoint?
And I do want to start by reiterating that you will see travel and per diem as a staffing type of solution, and the international candidate as more of a recruitment solution. So we do see some of the healthcare facilities look at it from maybe even 2 different budgets in regards to looking at international and what they spend for recruitment cost when they're recruiting a permanent staff member to their own facility. But if you're looking at the dollar per dollar, because we do have our people on contract for 2 to 3 years, it is an hourly rate that is all inclusive. There is no other additional cost incurred, no completion fee, no immigration cost, et cetera. None of that is there. But you usually see about a $10 to $12 to $15 an hour cost decrease from what you see from a typical travel type of placement. But additionally, there's some soft cost that a healthcare facility will also see, and that's related to the continual orientations that might be occurring, that they're using their own staff and bringing in continual per diem or travelers versus somebody who's going to be there over a longer period of time. And of course, when you're talking about consistency in patient care, that's hard to measure in regards to a certain financial dollar, but the international candidate works the holidays. They work every other weekend or whatever the weekend rotation is. They work what the committed shift is. And so consistency and having consistent staff is immeasurable, because that provides and ensures that you have quality patient care.
Excellent. And so, Laquanda, can you give us an example of one of our international nurses that we've placed and, an impact they've made at a facility?
Absolutely. There's so many because, again, to piggyback off of what Cathy stated, it's really hard to measure those the stories and the impact, because these international clinicians are coming. Their dream is to come to the U.S. and to be able to accomplish working in a westernized hospital setting, gaining that additional experience and education, as well as starting a new home for their families. So I could say majority of all of our international clinicians is a success story in itself, because they're making a big decision by, uprooting their families and trusting in our team, our clinicians, our recruiters, to basically provide them with the needed support. We have numerous nurses and clinicians who have received DAISY Awards, as well as nominations for the DAISY Award. This is also a huge highlight for our international clinicians to be recognized by their peers, as well as their patients that they're taking care of, and the families that they're affecting. So I do think that all of our clinicians' success is come from how they acclimate to the facilities, how they're acclimating to the community, and them staying on board with the facility after their contract has been completed.
Excellent. That's great. And so I guess for both of you, what advice would you give to healthcare leaders who are considering some of these different visa types, whether it be H-1B or TN or F-1, and how they can kind of balance those and create a make it more successful for their organization?
I think one is just understanding really what their need is, and not just for today, for what their future needs are going to be, and see how we can come in and help them with bridging their gap and partnering with them to provide them with alternative visa options to fill those needs throughout their future, openings. I think that's the biggest piece. With that is understanding what their current needs are, what their future needs look like, where they see that there's still some slight openings, or they have openings that have not been able to fill in a while, how we could possibly come in and help them with providing those alternative visa options that can be quick starts. And those quick starts can turn into long-term full-time employees.
And what I would like to say, and the nurse in me, we're always looking for professional growth and development. And in having international candidates as part of your workforce that you have within your facility, this provides another opportunity for your own employees to be precepting and working with different cultures and working with different things that they might know, and also providing an avenue for continued professional development for the candidates that are international, as one of the top things that we hear for their reason for wanting to do this type of work and moving to the U.S. is professional growth and development. And our whole goal is to keep nurses in nursing so that we can ensure that everyone has adequate quality patient care. In regards to the clinical preparedness that we provide for our healthcare professionals, we have candidates that are trained here within the United States, so they're already acclimated to healthcare here in the United States and familiar with equipment processes and charting requirements within healthcare. We also work with other countries, as Laquanda went through the different visas, the experiences that they have. Many of those people have 5+ years of experience that they are actually bringing to the facility that they are going to be working. So they're bringing a lot of knowledge and experience with them to be working in that assignment. We do have clinical support that we provide to our clinicians prior to them arriving to the facility and the duration of their assignment. This is done through simulation training that we provide to them, on the job type training that we provide to them, just in time training that we provide to them, but it is a continuing ongoing process.
One of the things that we do prior to candidates being even matched with a client is to make sure that their education, their license is the same or matches here in the U.S., the education requirements here in the U.S. So we are, as Cathy stated, matching and working with very experienced candidates coming from other international countries who already have a master's, a bachelor's, or an associate in their profession. They're coming here to the U.S. They've already had prior work experience. So what our clients are receiving when they come over, yes, is there orientation that's needed? Yes, in order to get them fully acclimated to the facility and how the facility works. But majority of our international candidates are able to work as preceptors. They are also working as charge nurses, and they're able to come on and be offered management type opportunities once they have completed their contract assignments. So again, the end goal is to not only be able to place candidates just to fill a position, but we are placing very experienced, well-knowledge individuals at these facilities to work and provide great patient care. And so the end goal that we're hearing from our clients is that they're very happy with the international clinicians that come over because they are well-groomed, well diverse. They communicate well. They understand the knowledge piece of it.
So Cathy, our clients are, in the healthcare space. They know that well. Not all of them are well versed on the variety of different international visa options there are. How do we partner with those organizations and advise them on the right strategy and which options to use when it comes to international visas and bringing in international clinicians?
And that goes back to using the travel and per diem type model for your immediate short-term type staffing. Those are covering leaves of absences or new positions that you might have started. But when you're looking at international, start to look at what your vacancy rate is, what your retention and turnover rate for your facility is, and you might even be looking at it by each area, your general med surg, your critical care, or whatever. But look at those trends in regards to that. And the other critical number to be looking at is how long does it take you to find candidates? If you're only filling 50% of your positions, but you're losing 30% on an annual basis, you'll never get to the number you're wanting to get to. So you might be looking at a variety of different visa strategies in regards to getting some that will help you through that first hump as you're getting some of those candidates into your facility, because it might be taking you 45 to 60 to 90 days to get a candidate. So you might be looking to get one of your TNs or an F1 in during that shorter time. But then if you're looking towards that longer time and you're wanting more experience, because that's the other evaluation criteria is time, but it's also experience, because the experience level may differ from an F1 to an H1B type candidate in regards to what you're looking at. So we do work with our facilities in regards to looking at what those numbers are and providing them with a modeling that would include the different types of visas, which match their numbers and match the specialties or the type of candidates that they are looking for.
Laquanda, why don't you give us a little more insight into how we support our organizations from an immigration standpoint and some of the expertise we have within our organization to help manage that?
In addition to our clinical managers, we also have program managers. Our program managers are here to basically serve as advocates between our clients and also our healthcare professionals, is making sure that the clients have all the needed resources and all the needed support that they need, and while our international staff is working with them. They answer all payroll questions, our benefits questions, anything of that nature. They also, time and time again, will do site visits. Again, this is a way of bridging that partnership with the client and our healthcare professionals, getting us involved with any problems and solutions so that we can iron those out right away instead of waiting until the end. We also are able, prior to individuals arriving, we have a deployment department that helps them with their housing and get acclimated to the community that they're going to be living in, making sure that they have all the needed resources as well. And then we also have an in-house immigration attorney. What is different from other agencies, because this in-house immigration attorney is able to provide our clients and our healthcare professionals with and answer their questions in real time. And so these individuals are able to schedule appointments to speak with our in-house immigration attorney. These resources benefit not only the client, but also our international healthcare professionals as they maneuver through getting adjusted here in the U.S. and throughout their contract time.
Excellent. Well, Cathy and Laquanda, thank you so much for your time. For those of you watching, please reach out if we can, assist you as you navigate the world of international visas and bringing clinicians into your organization. We have a whole team ready to help you, and we look forward to talking to you soon.